Hi, this is Dr. Putman from Twin Creeks Health in Roseville, California. I just want to take a couple of minutes and talk to you a little bit about whiplash injuries. A lot of people wonder what exactly the mechanism of an accident is and how it causes damage to people's necks. So when a car gets in an accident these days, there's a lot of energy that's being released. The newer cars have these crumple zones that are designed to absorb the energy. But any other energy, any excess energy is absorbed by the things inside the vehicle. So anything sitting loose on the seats, for example, will go flying. And another area that the energy is absorbed is by your head and neck. And so when a car gets struck, there's what's called a flexion extension injury. So immediately the person's head goes forward, like in this illustration here, and then when the car stops, it dramatically goes backward. Any number of things can happen from those type of injuries. You can have tears in soft tissue, like in here, this illustration right here is a little tear in a tendon in the back part of the neck. You could also have tears in tendons of the muscles in the front or the side part of the neck. You could have damage to discs in the front part of the neck. Any of these tissue injuries will get inflamed, and then people will feel sore from that. And then as the inflammation dies down, the soreness tends to go away. Now what happens though is when you get inflammation, scar tissue starts to form. And that scar tissue can adhere to nerves, it can adhere to joints, and really that's where long-term significant injuries from car accidents happen. It's not because of the initial damage, it's because of all the scar tissue that forms after the injury. That's why people from insurance companies, they know all this stuff. They'll call you right away after an accident within a couple weeks and say, oh, are you injured? And you'll say, well, no, I'm feeling okay. And they'll offer you a couple $100 just to sign off of liability, because they know within 6 months or 8 months, if you haven't taken care of it, you're going to develop symptoms. And it's super, super common. That's why after an accident, it's always important to get checked by a chiropractor to look for any signs of inflammation, any signs for tissue damage like muscles tearing or stretching, or any type of disc injuries. It'll prevent long-term consequences such as chronic headaches or numbness or tingling in the feet or hands, and ensure that you don't have any long-lasting residual results from your accident. So that's it for today. Have a great day.